Hi, I'm Lisa Costa-Bir and we're here at the 8th Annual NIIM Symposium 2023, Melbourne. I'm here with Dr. Stan Rodski. You're a neuroscientist, is that right?
That's correct.
Fantastic. Now, can you tell us a little bit about your presentation today?
Sure. Look, today was about finding ways to improve sleep for the majority of us. In other words, there's a third that sleep really well, a third who sleep sort of well, and a third who sleep badly. The badly get a lot of attention. The third in the middle get very little. That's probably you and me, yeah, always. Well, there you go.
Except here when I'm not in my own bed.
Correct. And as I said in my presentation, continually mattresses come up as a number one marker for good or bad sleep, depending on how well it is. But the point of this presentation was to show some of the things that I put together in my latest book, The Neuroscience of Excellent Sleep. What are some of the things we in the middle, those that if you were asked, how well do you sleep, fair to poor, you know, maybe fair to good sometimes, fair to poor more often, but fair, that's a group that really needs to focus a bit more on their sleep and what they can do beyond just what we might call environmental factors, like mattresses.
So, if we haven't read your book, can you give us a little summary of what they can do to entice us to go out and get it?
Oh, okay. Well, we always want that to happen, don't we? Look, I focused on the neurological marker, and by that I mean a neurological point where we can say if we can affect that, we can affect sleep. And that marker was a thing called HRV, heart rate variation. Heart rate variation is at the interval between each heartbeat. So even though you may, for example, be sitting there and at 60 beats per minute, I could be sitting here at 60 beats per minute, but you could be quite relaxed and I could be quite nervous. I would have a very low HRV. You would have a very high HRV. What we know is that HRV affects our autonomic nervous system, and the autonomic nervous system is driven by the para and sympathetic nervous systems. One relaxes, one stimulates. And so if you bring all that together into the world of sleep, you can imagine when you go to sleep, if you're one of the people watching this who has trouble falling asleep, and some of you may, around me here listening to this, have trouble falling asleep on occasion, it's because your sympathetic nervous system, the active nervous system, is overworking. You have, in fact, and your HRV has no gaps. It's just beep, 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 beep all the way through, and you have trouble falling asleep. The alternative, of course, is exactly that. You would fall asleep straight away because your system goes from being stimulated by doing something like this to spotting the bed and your pillow, and off you go. And so the things we talked about to improve in all of that, there were three things that I brought in to say these affect HRV. These three things can change your autonomic nervous system.
I'm dying to know.
Have I spread this out enough yet? You know, like on one of those online things when you start reading it and all you want to do is find out what it is.
Yeah, the anticipation.
You keep going and they never let on. Okay, the three things, some of them we've known about a lot and some of them are relatively recent and being researched. The first of those is, in fact, we can produce better HRV simply through breathing. So we can take control of our autonomic nervous system because the autonomic nervous system controls all of your organs subconsciously except one, Do you know which one that is? It'll be pretty obvious given where I'm going with this.
The heart?
Well, almost the lungs.
Okay.
Because you can stop breathing right now, simply because you want to. Go on, stop. Just stop. Don't take a breath, just stop. Stop. I'll let you know when you can start breathing again. Okay, away you go. You can start breathing again. Well, see, you overrode the autonomic nervous system. Now let's take another function of your autonomic nervous system. Stop yourself from sweating. No, and please, no analysis. No, my point is that there is only one organ that for some reason in our evolutionary development we got control of to some extent was our lungs. And so breathing actually can affect your HRV, can affect your relaxation. And I can say 40 years ago, because I've been around a long time in this world, but 40 years ago, this meditation stuff, this, it was third world, new age. Oh my, what is going on here? Everyone knew it worked, but they couldn't prove it in the science until this sort of thing started to occur, where we can actually see why breathe. So if I, for example, right now breathe in quickly, you too, yep, and hold, and now slowly out, you've actually created heart rate variation. You've stimulated the system quickly, and then you've relaxed the system slowly. That's a variation. When you're in fright and flight mode, there's no relaxation in there. The beats are equidistant. You're ready to go, fight, do whatever type of process. So that was the number one thing that I talked about, was the use of breathing and how important. And using that for 10 minutes before sleep can probably deal with about 50% of that 30% in the middle that I talked about, will help them go to sleep. But that isn't enough for some. And I moved to a second technique which requires 20 minutes, and that was the colouring books.
And we've got all of those in our show bags, and they're available online, right?
Correct. Yeah, just need to go to colourtation.com. And they came out. I was with a patient. I was working as a psychologist in an executive health practice here in Melbourne in Bourke Street, and I had a patient, quite serious issues, who I had hooked up to the technology that I demonstrated in the presentation to measure the HRV. She was hooked up to that, and she said, oh, look, and we were talking about how to try to relax. She had all sorts of phobias. And I said, why don't you, we'll just pop this on to watch you. And she said, look, do you mind, I find this colouring in relaxes me. I said, does it? And so she started colouring in, and I started watching the computer go, ooh. And that gave me the hint that there is a second level here, particularly for people who find this breathing stuff is, particularly mindfulness, meditation. They are fantastic things if you can do them. But what if you're busy hands, and you just, then a colouring book. And I found this with all the executives. They would start colouring, and they could take it away and do it. I could say, if you're busy or you're stressed or something, overworked, no, you don't have, you're embarrassed, males. The females never embarrass the males. Oh my goodness, what are we doing? They would just start colouring, and they would, in 20 minutes, feel relaxed, ready for sleep again. And in the presentation, I also showed the relationship of colour choice to mood. And so I presented the colours up there, and I talked about the studies that actually reinforce that this actually works. This whole colour movement and colouring in books actually started with me, because the book was picked up by Oprah Winfrey. And in her 2016 Christmas wish list, I was in there. And then began the craze. They thought it was a craze, but it hasn't gone away. And in that, we also discovered that certain colours. So that patient, for example, when she was at her worst, her colours were dark. When she was at her best, the colours lit up. but was there something that works both ways there? And we've got a big study going on in Leeds University School of Colour Science with 200 people, and we're looking for the colour relationships to things like resilience and sleep and mental health. So if I use certain colours, then certain things will happen, because it's so deep in our brain. It's so deep in our cortex, particularly in our lizard brain, our original brain area. These are things that are very primal. So that was my second thing. Try thinking about using my colouring books, which have got, they're geometric, you can't get competitive, you can't say my house doesn't look like a house, but you do stay between the lines because the brain loves control, it loves pattern, it loves repetition that creates pattern, and that relaxes the whole system. And the third area that I went through with everyone was using tones in the brain called binaural beats. And in our lab, I showed a picture of our lab, all the musical gear, the computers, the brain scans, but we actually found 3 levels, which we now produce that can take you into sleep. Just use it for 10 minutes before going to sleep if that's the problem. 20 minutes before sleep, we've got brainwave levels that will keep you asleep, and also 30 minutes if you have trouble with everything going into sleep. And so I was able to show the studies that prove that. So we have those available on site they can download them and use them forever. And our ongoing research, just to finish this, is around linking the technology. So what we're working on now is that while you're sleeping, you just wear some earbuds. You wear a wristband for the HRV technology, and all of those talk to each other so that if you don't fall asleep easily, it will come on because it recognises the HRV level that it needs, and it will play a very low tone. You can hardly hear it. The brain can, you can't. It'll play that. If you're about to wake up, it'll come on. It won't wake you up, but it'll keep you asleep. And that's where the technology's going. Well, that was only your first question. What are we going to, we're going to be going for hours here. No, that's the whole lot. There you go. There you go. Colourtation.com is where they can.
Well, that's what I was going to ask. So colourtation.com is where our list.
All of this stuff is.
Yeah, fantastic.
And mindpeakperformance.com for all of the research and all of the studies, and they can even do sleep tests for nothing there. It doesn't cost you anything. Stress tests, that sort of thing. Energy tests, that sort of thing.
Oh my gosh, I think we're all going to be logging on straight away to do all of that. Thank you so much for being so generous with all your information.
No, it's a pleasure, and thank you.
Thank you. Thanks everyone for joining us. Don't forget to check our socials and visit our website for all our articles, infographics and podcasts. I'm Lisa Costa-Bir. We'll see you next time.